In this session, we are going to talk about the ischioanal fossa. Ischiorectal fossae or ischioanal fossae are twin fossae lies at the sides of the anal canal, and each space or fossa appears like a wedge space and lined by thick and large fascia. We find the two fossae communicate with each other posterior to the anal canal. When we talk about the boundaries of each ischioanal fossa, we find the base is formed by the skin and the fascia related to the skin in this area, and the apex is directed upward or superiorly and formed by the area lies between the medial wall and lateral wall. We find the medial wall is formed by the levator ulni muscle, and the lateral wall is formed by the obturator internus and its fascia beside the ischial tuberosity. As the most of the spaces in the body, we find the ischioanal fossa contains many structures like fat. Also we find pudendal canal. This pudendal canal contains internal pudendal vessels and nerves, or what we call the pudendal neurovascular bundle. Also we find the inferior rectal vessels and nerve, and we can find perforating branches of S2, S3 and perennial branches of S4. On the lateral wall of the ischioanal fossa, we find the pudendal canal, which is formed by a splitting of fascia of the obturator internus, and as we mentioned above, it contains the pudendal neurovascular bundle. The pudendal nerve is one of the structures that lies in the pudendal canal, or we can find inside the pudendal canal. It is a branch of the sacral plexus and arises by roots of S2, S3 and S4. This nerve leaves the pelvis through the greater sciatic notch or foramen, and then re-enter the pelvis through the lesser sciatic foramen. After that, it runs forward inside the pudendal canal. The pudendal nerve gives many branches like inferior rectal nerve, dorsal nerve of the penis or clitoris in the female, and the perineal nerve. The internal pudendal artery has the same pathway or course of the pudendal nerve. That means it arises from the internal iliac artery inside the pelvis and leave the pelvis through the greater sciatic notch and re-enter the pelvis through the lesser sciatic notch and pass forward through the pudendal canal in company with the pudendal nerve and internal pudendal veins. Gives many branches like inferior rectal artery, branches to the penis in the male, and branches to clitoris and labia in the female. We find the tributaries of the internal pudendal vein run in company with the branches of the internal pudendal artery. Sometimes in forceps delivery may need to block the pudendal nerve through procedure called pudendal block. This procedure formed by anesthetic to produce analgesia in the perineum, and the anesthetic can be injected through two methods: transvaginal or perineal. Perineal abscess produced by fecal trauma and infection to anal mucosa, and it may be submucosal or subcutaneous or pelvirectal, okay, or ischiorectal. Spreading or inadequate treatment of abscess may lead to the formation of anal sinus or anal fistula. Ischiorectal abscess is a condition occur in the ischiorectal or ischioanal fossa. We knew that the ischioanal fossa filled by fat, and fats generally poorly vascularized, and this thing make this area vulnerable to infections from the anal canal. The abscess of one side may spread to the other side behind the anal canal. As we know, there is a connection between the two fossae posterior to the anal canal.